This Black History Month and every month, we honor the Black doctors, researchers, and public health pioneers who changed health in America despite facing barriers at every single turn. They worked heroically to improve the very systems determined to keep them down. Today, Black people are about 12 to 13% of the United States population, but only about 6% of physicians, a gap that reflects centuries of exclusion from medical education, research, and leadership, a reflection of systemic racism that permeates our health system today. And yet, Black public health leaders and scientists have shaped how we understand, prevent, and treat disease. Meet a few of the pioneers. I will share more as the month goes on in between other series. Dr. James McCune Smith used statistics in the 1800s to fight racist medical myths. Dr. William Augustus Hinton developed a widely used syphilis test that improved diagnostic accuracy nationwide. Dr. Paul Corneli, the first Black president of the American Public Health Association. William Edward Burgard Du Bois documented how racism impacted health decades before we started using the phrase health disparities. Dr. Marilyn Hughes Gaston expanded care access for children and families through federal public health leadership. These pioneers were redesigning and redefining our systems, and representation continues to matter. Black men and women are underrepresented in science and medicine. Less than 7% of doctoral candidates in science and engineering are Black, and Black people make up roughly 9% of the STEM workforce. More diversity improves patient health outcomes, trust, and innovation, especially in communities historically underserved by our health system. I talk about this more in my reel on health as a civil right. Representation in healthcare also saves lives. Research shows that patients often have better communication, higher trust, and sometimes better outcomes when treated by physicians who share or understand their lived experiences. Diverse research teams also produce more innovative science and are more likely to study conditions that impact underserved communities. But representation alone is not enough. We also have to intentionally dismantle the systemic racism that shapes our healthcare system. We've seen segregated hospitals, unethical research, major differences in health treatment based on skin color, and funding gaps that still exist to this day. Increasing the number of Black and other Black and Indigenous people of color professionals in medicine, research, and public health is not just about increasing diversity. It is about equity, and equity is not a dirty word. It's about repairing harm. It's about rebuilding a system that works for every single one of us. This month and every month, please do more than learn their names. We should be actively sharing their stories and honoring their legacies. Health equity is public health history in the making. Happy Black History Month.